If I had to describe what being human meant in a data and a communications context, I guess for me it's really all about personalisation. It's understanding that every individual is distinct, they have distinct behaviours, characteristics, demographics, and then it's making sure that they've got the content and the information they need according to their individual circumstances. So really being human is about being able to put yourself in someone else's shoes, but actually having the data and the insights to back up that understanding of the individual circumstances. So in terms of healthcare organisations that I've been really impressed by, particularly with how they've communicated with target audiences online, well, I'm going to go slightly out there and call out an organisation called Wakey Wakey and their online TV channel called Wakey Wakey TV. They've combined a very famous drag act with a TV presenter and a mental health specialist to produce an early morning show which is all about establishing routine and helping people to get involved, understand and take action to improve their mental health. It's both brilliantly entertaining, it reinvigorates the idea of that early morning regular sort of wake up TV, but it's also been fundamentally crucial to helping people establish really good behaviours around mental health. So I'd really recommend it, and I've been really impressed by their creativity, particularly with how they've used the combination of social media, online TV and regular magazine content. So when it comes to whether there can be such a thing as too much COVID messaging, I think in honesty, what we've really struggled with is where brands have got involved in COVID-19 messaging, but don't really have the authenticity to do so. And I think initially where we saw brands that were maybe outside of healthcare and not involved in health educations jumping in almost into the debate, that was where it felt that actually there was just a bit too much, there was sort of too much engagement, and actually what we really needed to do was almost sit back and let the government, policymakers, as well as the medical establishment kind of get across what was going on. So I think my only concern is where it feels inauthentic to a brand, and I particularly would think about brands like Brewdog, for example, who to some extent, while doing the right thing in terms of changing production lines to producing hand sanitizer, actually it just felt to some extent that they were sort of jumping onto a bandwagon that really they should have stayed away from. So I think the real challenge when it comes to a health emergency such as the one we've been through is about making sure that we're respectful of what people need to hear versus what is the brand benefit always. And I think that's always the tightrope for communications professionals.